Many times, folks are still dealing with thyroid symptoms like constipation, fatigue, brain fog, poor motivation, dry skin, thinning hair, despite their doctors telling them their labs are normal. So today, I want to discuss the 6 most important thyroid markers that you should have checked if that's you. My name is Chris Jones. I'm the owner and clinical director of Wellness Movement, and I would greatly appreciate a like, comment, and maybe a tag a friend or two that could benefit from this information. So the problem, TSH, again, thyroid stimulating hormone, is actually a pituitary hormone, and researchers have agreed for years it's really not the best gauge of overall thyroid health or thyroid performance. One of the other problems is that most hospitals have a really wide range when it comes to TSH. 0.5 to 5 is typically the range. The reason it's such a wide range is that they're taking a bell curve average of all the sick people that go to the hospitals. So you and I both know that most people that go to the hospitals are not well. They're not the picture of health. Thankfully, smarter doctors, researchers, and scientists came along. They pooled over 10,000 healthy individuals that were not on drugs or medications and not diagnosed with any conditions, and they came up with what's called the functional or optimal range for TSH. This is actually 1 to 2 TSH as opposed to the really wide range of 0.5 to 5. So most people feel best in that 1 to 2 range. Okay, free T3 is king when it comes to thyroid hormones, but most people have never had this checked. So T4 is inactive. It comes from the thyroid gland, but it has to be converted into free T3 in order for our body to benefit from thyroid hormones. This mostly happens in the liver and the gut. But where do most people have chronic inflammation? The liver and the gut. Okay, so liver and gut health, extremely important. We have to detox, we have to cleanse, and that's another topic, but gut health, liver health, so important, even when it comes to thyroid. Optimal T3 levels are important for beautiful hair, nails, good energy, and metabolism, optimal gut health, sharp mind, and of course, good mood. And just FYI, Synthroid, the common thyroid hormone, is actually synthetic T4, and it still must be converted into free T3 for us to feel well. Some others, in fact, 4 other thyroid markers to consider when you're trying to evaluate metabolism and overall thyroid hormone health. So besides TSH and free T3, free T4 is really important. That's what's produced by the thyroid itself and then gets converted into free T3. Reverse T3 is what's actually made in times of chronic stress. So reverse T3 gets elevated, and that actually competes with binding sites for free T3. So in times of chronic stress, more reverse T3 is made, and our body's not able to process and metabolize T3 as well. So we have more thyroid symptoms during times of chronic stress. So think about it. Whenever you're stressed, you feel fatigued, dry skin, just poor brain health, brain fog, and things like that. TPO antibodies, thyroid peroxidase antibodies, gives us a good gauge of the immune system and inflammation. So this is one of the 2 markers that we look at to determine if there is an autoimmune thyroid condition known as Hashimoto's or Graves'. The other one is thyroglobulin antibodies, or TGB. I like to look at both of these when I'm working with folks, and TGB is actually a monitor or gauge for thyroid cancer treatment and recurrence, and it will also be elevated when women are on birth control and taking estrogen hormone replacement. So TSH, having it in that 1 to 2 range, free T3 is the most important, one of the most important, but then we want to also look at free T4, reverse T3, TPO antibodies, and TGB. So again, if you think of somebody that has some thyroid symptoms, maybe you've had conversations at lunch or work, and you were just talking about this, like it, tag them, share it with them, and let them know that there's more that can be done. Thank you.